Hello there. Welcome on in. You're here for your potential Botox treatment. Okay, perfect. Since you are a first-time patient, just have a few questions for you. Can you confirm your first and last name? Okay. And what about your birthday? And I know you're new to our clinic, but have you had any sort of Botox or filler treatments before elsewhere? Okay. Any medical conditions we need to be made aware of? Okay. Any blood disorders? Are you on blood thinners? What about skin disorders? Okay. Are you using any prescribed products on your face? Okay. Okay. And do you have makeup on today? Okay. Good. Do you prefer a clean face? But don't worry, if you ever have to come in and you have makeup on, I can always help you take it off, so don't worry. Okay. Okay. So, I'm just gonna have a look at your face and kind of feel around, and then we can kind of decide on which treatments you're looking for. I'll go over a bunch of different options. You by no means have to choose every single thing. I just want you to get a feel of the options that you have. Okay. Okay, perfect. And if you have any questions throughout all of this, you just let me know. Okay? So, just to start, I just want to have a look at your lovely face. Okay. Good. I'm going to ask you a couple times to do some facial expressions. So for the first bit, can you raise your brows up as high as they can go? Okay. Now kind of make a frown, angry face with your brows there. Yeah, good job. Okay. Can you smile great big for me? Okay. Can you frown? Good. Good. Okay. Just gonna pop on some gloves and have a feel of your face if that's okay. Now, offhand, before I go over all the potential options, are there any areas that have brought you in today that you're most concerned with? Okay. Well, that is very normal, not abnormal at all. Okay. Perfect. Well, you have absolutely beautiful skin. Yes. Can I touch? Okay. Yeah, you have very beautiful skin. And I will address the areas that you are not comfortable with, which is fine, but also just remember you are absolutely gorgeous. Yeah, but we will make some adjustments for however you choose. Can you clench your jaw for me? Thank you. Smile great big again. Lift your brows up. Okay, let me just feel your temples. Okay. Can you smile again for me? Great big. Thank you. Okay. So, what we're going to do is I'm going to ask you again to do some of those facial movements for me. And I have just a little marking pencil, and we'll just mark some of the areas for your options so you can have a visual instead of just giving you a bunch of information and then not remembering where I've potentially mentioned to place the Botox. Okay? Okay, perfect. So let me grab that. Okay, so going to start. Can you raise your brows up for me again? Okay. And relax. We're just going to mark where some of those lines are. Okay. Raise your brows again. And relax. Good. Okay, so for the marking the upper forehead right now. Okay. Now lift again with the brows, just noting kind of the mid forehead. You can relax. Thank you. Good. Doing all right so far? Perfect. Now if you could kind of make an angry face with your brows and relax, just marking between your brows here. Okay, angry face again. And relax, just marking the potential of where we could put a few units. As I said, not everything is necessary. I just want you to have all the information of what we could potentially do for you. Okay. Now I want you to smile great big. Just gonna look at around your eyes. Relax. Yeah. Some people call it crow's feet, although I will say you don't really have much here. Some people prefer to do preventative Botox, while others want to wait a little bit longer. Smile great big again for this side. Thank you, and relax. Again, just marking the potential places of your preference. Smile again. Okay. Then we could always do some injections for a bit of a brow lift. Some people prefer that if there's not quite symmetrical brows, although your brows look fantastic. I don't think it's needed, but is that something you are interested in? Okay, if we were to do that, there would be points here and here, but I'll tell you, but I don't think it's really necessary for you. Exactly. Okay. Just relax your face for me. Thank you. Good. Can you smile again for me? Just the potential of temple here. Relax. And smile again this side. Just there, relax. Good, okay. Now, moving lower. Have you been interested in any sort of Botox in your chin area? Okay, again, we'll just mark it, but it's going to be up to you. So can you do kind of an upside down frown, like really? Okay, good. Relax. And frown again. Okay, good. This area may bother some people. I hear people calling it like orange pill chin, but it's very natural for this muscle to move that way, so it's not abnormal at all. But it's just personal preference for each person, of course. Yeah. Okay. Okay. Now, what about your masters here? Do you grind your teeth, clench your teeth at all? Do you mind if I just have a feel of the muscle? Okay, so just kind of clench. Okay. And same on this side, clench. Okay. Relax for me. Clench this side. I'm just going to mark it just in case. It can help relax that muscle so you don't grind or can relax. Have some of that discomfort that a lot of people wake up with, which can then cause headaches and inflammation. Okay, clench on this side. We'll just outline that muscle here as well. Relax. Your muscles here do feel a little bit strong, so the Botox treatment would just kind of relax them a little bit so you're not fighting with such a strong muscle there. Okay, and what about headaches? Do you experience headaches? Again, we'll just mark just in case. We can do temple into the hairline. Can help with headaches and migraines. Okay, let me just feel your temples. Can you clench your jaw? Yeah, you can kind of feel it all the way up, right? Okay. Relax. And now clench. Some little dots here, temples into the hairline. Relax. Same here, clench. Little dots into the hairline. Alrighty. Okay, I think that's the spots that we wanted to discuss. Okay, so if you just look in the mirror here, you can see the little polka dots we've added. So you can kind of get a feel of where we could potentially put the Botox injections from your forehead, top of your forehead, mid-forehead, around the center of the brow, out to the temples and hairline for potential migraines and headaches, down around the eyes for lines or crow's feet. And then you have the muscle here outlined. You can kind of see the outline of the muscle there when you clench on both sides. Exactly, and then the chin as well is another potential option for you. Okay. I know it's a lot of information, but I just want you to have all the options. So we know you mentioned your problem areas to you personally. Okay. Yeah, of course. Looking in the mirror, which ones sit best with you is something you're interested in. Okay. No, that's perfectly good. Yeah, perfectly acceptable. Okay. Good. Well, if that sounds good, fine and dandy to you, I can go ahead and prep those units for you. Okay. Alrighty, and don't worry, I will wash off the other polka dots on your face and you don't leave like this. Okay, let me just prep that for you. Bear with me. Alrighty, so once more for your confirmation, just tell me which ones you would like to do today. Exactly, that's what I thought. So we're just gonna start at the top, then move down, okay? Okay, so we're just gonna use this little needle here, okay? Just a little bit of a prick, a little bit of a pinch there. Okay? Wonderful. So just relax. If you need, you can close your eyes. Do you want me to count down? Okay. 3, 2, 1. Okay, good. Is that okay? You doing okay? Okay. And symmetrically on this side here. Ready? 3, 2, 1. Good. How's that feel? Good. Okay, a couple more for you. Ready? 3, 2, 1. And lastly, you're doing so well. 3, 2, 1. Good. You did fantastic. Alrighty. Let's pop my gloves off real quick. Okay, so general aftercare instructions for you today. I'll send you home with a little sheet too, but you're gonna want to just relax. Don't do anything too strenuous the rest of the day. I would avoid exercise if you can. I would also try and avoid touching the areas, okay? Same for don't try to do any sort of harsh movement, massaging the face, anything like that. Perfect. It's also good to kind of be upright tonight if you want to sleep. Maybe a little bit of a propped position can be really nice to do the desired effect of the placements that we've done today. I also recommend you avoid alcohol for a few days, in some cases even too much caffeine. Okay, hydration is lovely, always fantastic for the skin, but especially when you've had a skin treatment or anything like this, hydration is amazing. Water, some of those electrolyte drinks, Gatorades, things like that. Perfect. Now also keep in mind that sometimes the Botox effects can take 3 to 7 days or so to take full effect. Okay, so you might not immediately see the result. Okay? Now, reactions that are normal, you may see some redness or swelling around the injection sites, even some bruising for more delicate skins. That's perfectly normal. You can do a ice pack or like a cold compress against the points. Yeah, it can be kind of relaxing. Just lay back on your propped up pillow there and kind of place the cold compress on those points. Can definitely help with the swelling. Perfect. You're going to have our contact number if you think you're having a negative reaction or anything like that, but it is fairly normal to have a little bit of the swelling or bruising, but if an intense pain comes or anything of that nature, we definitely want you to contact us. Okay, yes, and that's all in the packet that you're going to be sent home with today, everything that you signed and dealt with. Perfect. Just be gentle with your skin throughout this time period as the Botox takes effect. It's also going to be very important for you during this time to protect yourself from sun exposure. Yeah, so your sunscreens, hats, scarves, sunglasses, always very important. I'm also going to ask you to avoid any sort of anti-inflammatory medications for the next few days. They can just kind of have that reaction with the Botox treatment. Perfect. And then on your way out, we will schedule a follow-up appointment. So we'll see you in about a week and a half time, just to see the results, see how you are liking it, and if everything is going smoothly. Of course. No, it was my pleasure. Of course, take it easy the rest of the day. It was lovely to see you. Alright, bye now.